What is up, everyone? Please take a second to hit that like button. The more likes that we get in a short period of time, the more people the algorithm will bring into the chat to come hang out with us and see what's going on. So please take a second to hit that like button. I'm just getting everything set up. We're waiting for old man Walter Biden to come out and stammer and tell us stories about what his dad said, his mom said, his grandma said, his puppy said. Some ugly person on the corner told him one time back in Nam. Yeah. So stay tuned for all of that. I'm just getting everything set up here. What is up, everyone? How is everyone doing this morning? Good morning, warrior woman. Boom. Yes, I did hear that. I was watching Salty Cracker. Arnold Schwarzenegger says, "Screw your freedom." Yeah, no. No, that's not okay. What's up, Chris Cola? Hey, thanks, JB. I appreciate you being here. What is up, everyone? Kathleen, it's not just a puppet. That's Walter Biden. Stripe, I will check it out. Hey, thanks, Deb. Appreciate you being here. What's up, everyone on Rumble? Rumble is kind of hard to set up. It takes some time to get that whatever, the live configuration set up on Rumble. Hopefully they simplify that. What's up, Canisaur? Appreciate all of you watching on Twitch. Shout out to the 4 people watching on Facebook. It's hard to get viewers on Facebook. I don't know why. They must not like my content. I must not be liberal enough. Hey, thanks for being here, Crystal Clear. What's up, Viking Vet? Did you guys see that video of the parents at the school board meeting or whatever yesterday? I'm not even sure where it was, but they were all in the parking lot like screaming and yelling at doctors and stuff. I just seen that video right before I went live. I'm gonna have to look into that and see what that was about. There's a lot of claims that it's a false flag, that those aren't actually parents from that area and all this other stuff. Who knows? It's like you can't even believe anything you see now. For anyone who didn't see it, if you go to the Discord under the news tab, I've downloaded the video and then uploaded it on there for everyone to be able to download. I think what I'm going to probably do is create a tab for videos for people to actually download. Kind of like the people who've been watching the Mike Lindell stuff. We covered it last night, but at the end of their live stream, they play this movie that they put together that has all these clips. I can't even talk about it because of YouTube, but a very interesting movie that I think people should at least take a look at. It's a 22-minute movie they put together with lots of interesting content all gathered together. But videos like that I think people should watch. I think I'm going to create a tab on Discord and put videos up there for people to be able to download and share. There's lots of stuff that, you know, we all share and stuff, kind of like someone has already said in the chat. You see content that you think is worthwhile and you try and get it out to everyone, and then eventually it gets deleted or banned or removed or whatever, so you only have that much time to watch it. But I have all this software and stuff to where I can download videos on pretty much anything. Rumble, Twitter, Facebook, TikTok, Clapper, everything, YouTube. I don't even use links. People send me links and I just download the video. My phone is so full of videos. So I think what I'm going to end up doing is putting the videos on a tab, and then anybody that's in the Discord, you'll actually be able to download videos to your phone and then share them out to people directly, versus having a link where someone else will have the ability to take down that video. Adam, I'm not sure why you're not getting a notification. There should have been 2 notifications. Thoughtbot should have sent a notification, and then I sent one by hand through Discord. Check your notifications and make sure you don't have them turned off. Oh, a notification saying I went live last night. I may have forgot to send the notifications. I'm not sure. When I don't go live on YouTube, there's no automation. So if I forget to send out the notifications, you probably didn't get one. I'm going to look into that right now. Yeah, I sent a notification out at 7:09 p.m. Eastern time. I'm not sure why you didn't get it. Yeah, Katie, I think you're onto something. I think that is how it's going to go. They're just kind of edging us towards taking everything away from us. There's so much information coming out every day. I got penalized on Facebook because I shared a screenshot from the CDC website talking about green zones. I don't think I can say any more than that without getting banned on YouTube, but if you don't know what I'm talking about, join the Discord. I'll post it again, or go to the CDC website and search for green zones. And sounds real German like. It's not good. It's not a good thing. All right, Adam, if your settings are correct, get a hold of me and we'll work something out. Discord's kind of a funny thing. Hey, thanks for being here, Billy. Rebuild Biden's laptop. Which one? Which one? Yeah, Dave, that's the green zones. What's up, everyone on Facebook? I appreciate you guys watching. Ronan, I am currently live on YouTube, Twitch, Odyssey, Rumble, Facebook. Come on, old man Walter Biden. You're late. You're real late. You're supposed to be on 15 after. Good Lord. What's up, Anthony? I sleep when everything's better. We're not living like this anymore. Hey, thanks for being here, Tammy. Yeah, where's the puppeteers at? They need to shove that old man on stage. Maybe he's driving his truck there. He's on his way there right now. Good morning, who me? I'm in Michigan too. Where are you guys from? Let's post where we're from. Watch and see how many people are from Michigan. I think that has to do with the algorithm. I believe it, Stripe. Oh, I see, Adam. The We Are Live tab on Discord is for ThoughtBot. That way ThoughtBot doesn't interfere with our conversation and stuff. So, yeah, if I don't go live on YouTube, ThoughtBot doesn't make an announcement. And I post in the general chat. So I see what happened. Oh, we got a little bit of everybody here. Well, Bob, you're like 2.5, 3 hours east of where I am. We got almost every state here in the chat hanging out. And what's up, Bush Girl? I wonder why people don't use the chat on Rumble. I wonder if it's because I'm new. There's been a couple people who have said that they've posted comments in the chat on Rumble and then they disappear. So I'm not sure. I'm not sure what's going on with that. Yeah, Debbie, he probably is getting his injections, getting all set up so he can stammer on for about 15 minutes, and then he starts slurring his words and blinking and holding his head and forgets where he is. And then his handlers get him off stage before he says something a little too honest. Maybe they're running a little late writing his speech, getting his teleprompters put up. Yeah, I was pretty surprised that they're going to have old man Walter speak before Jen Psaki does. Normally we start with Raggedy Ann on stage there going, "That's a really great question. I'll have to get back to you." And then goes on to the next person and never says anything. Like, never says anything informative. Could be getting wiped up. It could be what it is. It's running a little late.
What must be what?
What's up, OG? Thanks for being here. Bush Girl, you're from London. I think you're the first foreign viewer we have listed right now. Well, thank you for watching. I really appreciate it. What time is it there in London? Oh, we got 2 people from the UK now. I'm reading 5 chats, so please forgive me if I don't read your comment right away. Oh, it's 6 p.m. in London right now. Well, good afternoon to all of you, or good evening. Jeez, did something serious happen? He's almost an hour late to his own show. They were like, "Why don't you be a little bit late? That's what Trump does, and everybody loves that. Why don't you be a little late?" He fell asleep on the couch. They can't wake him up. Have you guys been watching the Mike Lindell stuff today? I saw Right Side Broadcasting mention on Twitter he was apparently violently attacked last night. I don't know any more than that, but that's what they had posted on Twitter. Sunny days, you say something else so stupid, and I'm gonna ban you, and we're gonna sit here and talk crap about your mom, and we're gonna laugh about it and have a good time. You watch your mouth. I'm tired of you being in my chat like that. Channel Q, you watched Mike Lindell on YouTube last night? Does that channel still exist? Most channels that were showing Mike Lindell on Facebook or YouTube the last couple days, they're not even around anymore. It's so stupid what you can and can't show. What's up, status quo? Sucks. I'm not seeing any comments for Rumble. There's almost 30 people watching. At least that's what it says on this browser page. I know you guys want to talk, but I don't see nothing in the chat. What's up, COZ? I appreciate you, Debbie. Hey, thanks for being here, Angry Farmer. What's up, Martin? Out in Scotland. Thank you for being here. Consumer online. No, Rumble's kind of weird. Yesterday was our first time going live on Rumble, and I was commenting with one or two other people, and then I had 3 or 4 people write me and ask me why I'm not responding to them, and they were sending me screenshots where they've actually made comments in Rumble, but it wasn't showing up on my end. And when we first went live, I was watching Rumble through my phone through the app, and there's no chat box. And then an hour into the live, the chat box popped up. So I don't know if Rumble's making changes or if it's because I have a new account, or I'm not sure what it is. Oh, status quo, you're in California, huh? I was hearing that they're mandating all their educational staff to get the Fauci ouchie. I don't know how many people they want protesting in the streets. You see the nurses. I'm going to check the White House schedule. Old Man Walter's almost an hour late, and they have something else going on today, and I wonder if we're going to end up watching that, and then all my titles are going to be untrue, and everybody's going to be blaming me. So let me check this really quick. Says at 11:15 Eastern time, this event is supposed to be going on, and then at 12:30, which is in 25 minutes, press briefing, White House, C-19 response team, and public health officials. And that's all it says, so who even knows what that means? Thanks for being on Rumble, D-Bert. That's the only comment I can see. Dog21. You can see 3 comments on Rumble. I don't know. I don't know what's going on with that. I think it's on Rumble's end. I'll check it on my phone really quick and see if it looks any different. I see people talking in the comments, but the comments is not the chat box. See, I think the way their app is set up is confusing. I think people are leaving comments thinking it's the chat box, and you can't even find the chat box on the app. It's really clear on the browser. Someone was telling me yesterday that Rumble's going to come out with their own version of Super Chat and stuff, which I think is interesting. Oh, I see you guys in the chat box on Rumble now. Thank you guys for participating and being here for today's episode of Stammering and Saying Crazy Things by Old Man Walter Biden and myself. What's up, Grey Wolf? Thanks for being here. Hey, I appreciate you, Jose. Thanks for being here.
What must be what?
Maybe they're all sitting at the White House right now watching the live, scowling, giving each other injections and stuff. Yeah, I think it's only a matter of time before they are going to enforce these mandates. There's so much talk about it. I don't see what's going to prevent them from doing it. They do whatever they want. I know everybody's going to write in the chat, oh, this and that's going to happen. Look how far things have gone. I don't know. I don't know that people are actually going to stand against it. I know people don't want it. I know people don't like it. I don't know that people are going to actually do anything about it, though. Sonic Voice says, Biden watching Jeff Mack, wondering why he's late. Exactly. That's probably exactly what's going on. What's up, King Isaac? What's up, Captain Seamus? Thanks for being here. Just a moment. Had to sneeze. I don't want to do that on camera. Good Lord, everybody's gonna be like, he's got the sickness. He's down with the sickness. He's eating his Jeff Mac and cheese. It's too thick and creamy. He couldn't handle that. I didn't mean it the way I said it, but now that I said it, I meant it. It's okay. Maybe the military will appear in place of Waldo. Yeah, it definitely could be. That would not surprise me. The only thing that would surprise me is if everything turned around. They turn the screen on, Trump's there. I'd be surprised. They got rid of the Fauci ouchie. Oh, I'd be surprised. They took away all the mandates and let everybody go back to normal life. I'd be super surprised. I don't think we will ever go back to normal life. Yes, Beth, but I can't say any more than that. Pretty sure it goes against the community guidelines on YouTube. But yeah, definitely. Yeah, by the time they make another announcement on the news, you know, everybody's going to be buying up all the toilet paper and stuff. You got to be prepared full time. I think Rumble's going to end up being the new YouTube. There's so many people on Rumble, and their stuff, it works smooth like YouTube does. I mean, their chat is coming along, but everything else seems to be pretty smooth. And you can say almost anything on Rumble without having any kind of issue. I think they're going to end up replacing YouTube. Yeah, I wish old man Walter would stop talking about gas prices. They're trying to pretend like he's like it's lower than it's been 40 years, blah blah. You're a liar. You're a liar. That is not true. That is not true at all. I miss those Trump gas prices. That was like the first time I ever filled my gas tank up. As soon as it came, it was gone. Miss those gas prices. Well, I miss a lot more than that, but on the subject of gas. There was somebody arguing in a Twitch chat while we were covering Mike Lindell last night, talking about all the great things old man Walter Biden has done for the country. Couldn't believe it. I've only seen Trump supporters and Trump haters. I ain't never seen a Biden supporter before in my life. This guy was all about it. But every time I try to call him out, he just wanted to ignore me. He don't exist on there anymore. You get a couple chances, you're not going to ignore me in my chat. You don't respect me. You're out. Put some respect on my name. I just asked him if he supported old man Walter. So he didn't want to answer me. He knew he was in the lion's den. Jeez, this guy is an hour late. Someone needs to call his mama or something. He's missing. Check the tags around his neck. You know he's microchipped. They need to pull the app up. Where'd he go? Deb says she posted 2 articles in the general chat of Discord on Mike Lindell being attacked last night. I will look into that because I don't know anything about it. All I read was Right Side Broadcasting's tweet. Jose, I'm not sure. I'm not sure if Trump is going to run again for 2024. A lot of people are speculating that's some of the news that Mike Lindell is going to announce today. But I don't really know. I guess there's like some sort of law or something saying that a candidate has to go so long before they can announce campaigning again. I'm not sure how true that is. I've just read it a few times randomly here and there. So some people are speculating that that's why he hasn't announced it. Other people are saying he's trying to run for a different position. I don't really know. I don't see why he wouldn't. If you've seen any rallies he's done lately, the support is definitely still there, so I don't see why he wouldn't run. He's obviously not tired of the nonsense. He still fights it every day, so not sure. The only reason I could see that he wouldn't run is if he has plans for other things to support America in different ways. Maybe they're just gonna wait till the next deal in like 12 minutes. They're supposed to talk about C-19 and whatever else I just read off from the White House website. So then all my titles are gonna be wrong, and then I'm gonna look like a liar. Oh well, I tried my best. That's all I can do. Did you guys read about those arrest warrants in Texas? They, I'm pretty sure they went through. They tried to ban them, and somebody else overruled it. And I'm pretty sure they put warrants out for those Democrats that fled Texas when all that stuff was going on, and they went to D.C. And then I read last night before I went to sleep that they were getting ready to hand those out. Yeah, top. All those elected officials that are in office right now that are just behaving the way they are, they forget they're voted for, or they're supposed to be voted for. They can't just run around doing whatever they want, acting like outlaws. I think it's super annoying that anything that is government related runs like crap. It makes no sense to me. Like, if you do something wrong, or if you're summoned by the court or anything like that, the IRS, any kind of stuff like that, they can send your letter to the wrong address, and they still expect you to know what's on that letter. And you never receive it. You never know that you were supposed to get it. You don't know what's on it. You can still be arrested, still go to federal prison, still have all these consequences and stuff. And they expect you to be held to this high standard. But if you go to a state website or local government website, or you file for unemployment, or you're waiting on the president, or whoever that is, why is it so janky? Why is it ran like crap? They have a schedule posted right on the White House website, and they can't even follow it. Is it because they know that they don't have to be held accountable? Is that what it is? Because it is super ridiculous, in my opinion. I mean, think about how many times we've gone live covering a court hearing, or even watching old man Biden. The microphones are ran like crap. The cameras are bouncing around. It's just... You would think it would be better than Hollywood. They would have the top of the top running all this stuff. Just ran like crap. Well, in 8 minutes, press briefing about C-19 response team and public health officials is supposed to start. They just ran right over old man Walter speaking. I don't know. I don't know what to say about that. It could be Antifa running the show now. You see, they keep mentioning the White House and the government working with activists and stuff like that. They've talked about that pretty much the whole week. They keep mentioning it, collaborating with activists. Is that like working with terrorists? I don't know. I probably shouldn't say that, but that's what it seems like with all the stuff we've seen. Yeah, Norman, I was just talking about that when the live started. Somebody was talking about Biden's laptop, and I was like, which one? Which one? Anna, yeah, I can change my title midstream, but it's not easy to do on 5 platforms and still control everything, still make sure there's nothing I can't show on the screen, still read all the chats, still go through all the nonsense. It's a lot to juggle. As long as old man Walter is there when they do this next scheduled briefing, I'm not going to change the title. We're just going to let it fly. Rod RR. I know what you're trying to say, but it's not like that. It's only these people we see on the lives. It's not everyone. Your comment did not pass through the YouTube censor stuff. It's been flagged. No one else can see it, but that's not the right wording. Ken, I do have a couple mods, but not really. I have 2 mods. One jumps in from time to time, just see what's going on, and the other one just kind of hangs out and checks on the chat every once in a while. Nobody's actually modding the chat. YouTube does so much censorship that if you guys say anything you shouldn't say, it's half the time if you put a number or a color or a president's name, it gets flagged. I mean, it's very sensitive, so I don't really need moderation on YouTube. And Twitch is the only other toxic place. Everywhere else, everybody's really cool. I used to have a lot of mods. I used to have like 10 mods rolling, but they get that authority under their belt and they start mistreating people and stuff gets crazy. So I've pretty much calmed down on having mods. I've had a couple mods go rogue, show up and half your chat has been banned, half your viewers have been banned. You don't even know why. False claims. They create bad situations, and when they get bad responses, then they ban them. It's crazy. Some people let it go to their head. Little bit of authority over a chat on an online viewing session and just can't handle it. I don't know. It's weird to me. Hidden Biden. That's what this is. Where's Waldo? Yeah, Stripe. That's exactly what I mean. Is sometimes mods get out of control. Yeah, the mods I got right now, they're cool. They know. A lot of times it's just more like my mods are more for keeping everyone informed. Sometimes people are new to the platform, or they're new to how we do things, and they just help things run smooth. They're not really there to time people out or do any stuff like that. I'm reading all these chats all the time. Somebody speaks out of line, you're just banned. I'm not. The rules are in the chat. Everything is really simple. Just be civil. You say whatever you want, as long as it's, not racist, hateful, or threatening somebody's life. You're good to go. I mean, in my opinion, it's common sense. So I see someone speaking out the side of their neck, they're getting banned. That's all there is to it. What's up, Street Smart Geek? Thanks for being here. We're waiting on old man Walter, who may not even show up. We might end up on the next press briefing, or whatever it is. Tony says Antifa can't even run a bath. I agree. Mr. W. Gordon. Yeah, it would be like that in a way. The problem is a lot of people are like, oh, we need to impeach Walter. Well, then we'd be stuck with Harris, and she'd be the first female president. You think they're going to let her get impeached? Probably not. And even if they did, then I'm pretty sure Drunken Pelosi ends up being the person in the chair. And I don't think that's any better. I don't know. Not trying to rain on anybody's parade or realize how dark the times actually are, but I think about that all the time. We'd have to do like 4 impeachments before we got to somebody decent. It's a rough situation. Jose, I probably will cover that, but I can't show it on YouTube. I might be able to show it on Facebook. I can definitely show it on the alternative platforms, Odyssey, Rumble, and Twitch. I will definitely show that. I can't even say what it is, because that E word, I can't say anything related to it. But I will look into that.
What must be what?
Why? Goodness, they are taking forever. I need more coffee. I can't get off the screen because they'll ban my video for still images. My very first strike I got on YouTube was because I had a message on the screen telling everyone to go to Twitch, and it was running live, and they gave me a strike and wouldn't let me go live for like a week because of it. It was manipulative information or something like that. I don't know. That was the first time I realized how bad it really is on YouTube. People had warned me for the longest time, and it's crazy because I've seen Tom McDonald post this on his YouTube about when you talk about YouTube censorship and people think you're crazy. They're like, YouTube don't care about you. They don't care about you or what you do. You're out of your mind until you see it, and then you're like, oh, they will just reach out and touch you for any kind of little thing and knock you down a peg for absolutely no reason based off assumptions and stuff. Like I started getting my videos taken down and strikes for showing pew-pews on the screen during protest. The first time I got it was we were watching a MAGA Million march in Washington DC, and it was like the second or third one. It was like an all-day event, and then right around somewhere between noon and 2 o'clock it had calmed down. People were like going to get lunch and stuff, and there was a Second Amendment march, peacefully, people just exercising their Second Amendment, parading down the side of a street. They were not being chaotic or crazy or nothing. They were just expressing their Second Amendment, exercising it. And we went to go switch back to the Mega Million March, and they took the live down, and I got a strike for showing pew pews on the screen. And I, under like federal definition, it has to be lethal in order for it to, I mean, there's other parts of the definition, but the biggest part is it has to be lethal in order for it to be considered an actual pew pew. And I wrote customer service at a different time to speak with them about that, because during protests and stuff, they have the riot police will bring out paintball guns that fire pepper balls and stuff like that. So I wanted to write them because it seemed like anything that resembled a pew pew was getting my videos flagged and was giving me strikes and stuff like that. And they were threatening to delete my page or my channel or whatever. And so I wrote them and I said, well, in your community guidelines, it explicitly says firearms. And I'm like, to meet that definition, it has to be lethal. So what are we going to do about this? Because you guys are flagging me over paintball guns that are not lethal. And customer service was like, well, if we flag you, we flag you. That's all there is to it. So if we flag you, you're doing something wrong. Don't do it again. That was basically what they said. So they're not even like living up to their own stuff. It's customer service is a buffer to make you feel like you got an answer, while the algorithm who actually runs the whole platform screws you over. That's basically how it works. Geez, now they're late for the second event. The second event should have started 3 minutes ago. Who's running the White House? They need some management. Is there any adults around? Somebody, like, this is ridiculous. Right, Just Michelle? People gonna be out here flexing. They're gonna be like, boom, you've been taken down for the gun show. Destiny Gal, we're not even waiting on Jen Psaki. We're waiting on old man Walter. Well, and I don't even know what the other one is, because it doesn't say her name on that either. It just says press briefing by White House C-19 response team and public health officials. It doesn't even tell you who it's about. I'll see if that's on something different, but it should be on this. Okay, so they are starting a different video for this next briefing, whatever. So I'm going to switch that out, but that's also not live. They're also 5 minutes late. So just give me a second here. Bob, no, they can't block me. No. Even if they tried, I got so many accounts, there's no way. They're not blocking me. Hey, thanks for being here, David. I'm going to see if I can switch these titles up. I don't know if it'll actually matter, but since we have so much time on our hands, try and switch my titles up, because people are just ruthless on the internet, and every little thing you do wrong, they chalk it up to false information and everything else. I worded the title a little bit funny. We'll see if we can get through this without that blue box underneath the title. When they put that blue box underneath your title, that means they're basically going to shadow ban you. We'll see if we can get around it. I'm just going through changing all the titles. I don't think I can on Rumble. I think it'll end up shutting it all down. All right, people on Rumble, you see new people come in and calling me a liar, you straighten them out. There's nothing I can do about that title while we're live.
Good morning, and thank you for joining us. Dr. Walensky,
Thank you for joining us.
Smith, and I will keep our comments brief this morning so we can get to your questions. I'll start with an update on our fight against the Delta variant. The Delta variant continues to drive a rise in cases, with cases concentrated in communities with lower vaccination rates. In the past week, Florida has had more COVID cases than all 30 states with the lowest case rates combined. And Florida and Texas alone have accounted for nearly 40% of new hospitalizations across the country. We all know that vaccinations are the very best line of defense against COVID and how we end this pandemic. That's why we've been tireless in our efforts to get more and more Americans vaccinated. For the first time since mid-June, we're averaging about 500,000 people getting newly vaccinated each and every day. And overall in the last week, 3.3 million Americans rolled up their sleeve to get their first shot. In the past month, we have doubled the average number of 12 to 17-year-olds getting newly vaccinated each day. Critical progress as millions of adolescents start heading back to school. Importantly, we're seeing the most significant vaccinations progress in states with the highest case rates. In fact, in the past month, we've nearly tripled the average number of shots each day in Arkansas and quadrupled in Louisiana, Alabama, and Mississippi. So we're getting more shots in arms in the places that need them the most. That's what it's going to take to end this pandemic. More vaccinations, more Americans doing their part and rolling up their sleeve. Over the past few weeks, we've seen strong actions from across the public and private sectors to help end the pandemic. The president recently announced vaccination requirements for all 4 million federal workers, and we're working to apply similar standards to all federal contractors. On Monday, the Department of Defense announced its plans to add COVID-19 vaccines to the list of vaccines required for more than 1.7 million active duty, reserve, and National Guard personnel. And just this morning, the Department of Veteran Affairs and the Department of Health and Human Services announced new requirements. All 350,000 VA healthcare personnel and all 25,000 HHS healthcare personnel must now be fully vaccinated. State and local governments, healthcare systems, businesses, small and large, universities and other institutions are also stepping up. Since last week, Washington State, Washington, D.C., and Seattle have all adopted vaccination requirements. And more than 50 health systems across the country have announced that all staff need to be vaccinated, bringing the total to more than 200 health systems. Just in the past 24 hours, Amtrak, McDonald's, NBC Universal, Discovery, and Capital One all announced new rules that workers must be vaccinated to return to the office. California announced all school teachers and staff in the state serving more than 6 million students will be required to be vaccinated or tested weekly. And the NEA and the AFT, two of the largest unions in the country, representing 5 million educators, childcare workers, and school staff, both came out in favor of school districts pursuing COVID-19 vaccination policies, including requirements for teachers and staff. And across the country, nearly 700 colleges and universities have announced vaccination requirements, which will cover roughly 5 million students getting ready to head back to school. So clearly, vaccination requirements are gaining momentum across the country and are already covering tens of millions of workers, educators, college and university students, and healthcare providers. They will help keep people and communities safe and help stop the spread of the virus. Here's the bottom line. Through vaccination requirements, employers have the power to help end the pandemic. As we drive progress on vaccinations, we are accelerating our efforts to help states respond to outbreaks caused by Delta. Our COVID-19 surge response teams have deployed more than 500 federal personnel, including hundreds of healthcare personnel in Louisiana, Mississippi, and Arizona to provide emergency medical care. CDC is on the ground in Tennessee, Illinois, and Missouri to help local outbreak investigation and vaccination efforts. We've sent ambulances and paramedics to Missouri and Louisiana. And in Florida, we've stood up dozens of free testing sites and sent 200 ventilators to hospitals in the state. And importantly, as Dr. Nunez-Smith will discuss, we sent 5 times as many life-saving therapeutics to states in July compared to June. I'll close with this. We are doing everything we can to get people vaccinated and support state and local leaders on the ground. But as we have said from the start, ending this pandemic requires every American doing their part. So please, if you're unvaccinated, get your shot. It's free, it's convenient, it works, and it's never been more important. With that, let me hand it over to Dr. Walensky.
Thank you, Jeff. Good afternoon. Let's begin with an overview of the data. Yesterday, CDC reported 132,384 new cases of COVID-19. Our 7-day average is about 113,000 cases per day, and this represents an increase of nearly 24% from the prior 7-day average. The 7-day average of hospital admissions is at about 9,700 per day, an increase of about 31% from the prior 7-day period. And the 7-day average of daily deaths has also increased to 452 per day, an increase of 22% from the prior 7-day period. We continue to see cases, hospitalizations, and deaths increase across the country. And now over 90% of counties in the United States are experiencing substantial or high transmission. As we have been saying, by far, those at highest risk remain people who have not yet been vaccinated. This week, we are taking 2 important steps in encouraging and improving vaccine protection for Americans. First, for pregnant people who are at higher risk of severe illness from COVID-19, we are strengthening our guidance and recommending that all pregnant people or people thinking about becoming pregnant get vaccinated. We now have new data that reaffirm the safety of our vaccines for people who are pregnant, including those early in pregnancy and around the time of conception. These data build on previous evidence from 3 safety monitoring systems that did not find any safety concerns for pregnant people who were vaccinated late in pregnancy or for their babies. Now, these new data found no increase in the risk for miscarriage among people who received an mRNA COVID-19 vaccine before 20 weeks of pregnancy. Clinicians have seen the number of pregnant people infected with COVID-19 rise in the past several weeks. The increased circulation of the highly contagious Delta variant, the general low vaccine uptake among pregnant people, and the increased risk of severe illness and pregnancy complications related to COVID-19 infection among pregnant people make vaccination for this population more urgent than ever. Second, I want to take a moment to discuss what we are doing to help increase protection against COVID-19 for certain individuals who are moderately and severely immune compromised. As we've been saying for weeks, emerging data show that certain people who are immune compromised, such as people who have had organ transplant and some cancer patients, may not have had an adequate immune response to just 2 doses of the COVID vaccine. To be clear, this is a very small population. We estimate it to be less than 3% of adults. We've been working to identify how best to provide increased protection to these vulnerable people who are disproportionately impacted by severe outcomes due to COVID-19. FDA is working with Pfizer and Moderna to allow boosters for these vulnerable people. An additional dose could help increase protection for these individuals, which is especially important as the Delta variant spreads. Following FDA's decision, CDC will hold a meeting of its Advisory Committee on Immunization Practices tomorrow to discuss this issue and offer their expert insights and recommendations. We look forward to that discussion and to helping support this vulnerable population. At this time, only certain immune-compromised individuals may need an additional dose. Emerging data, including from a significant study published in the New England Journal of Medicine yesterday, show that there's an enhanced antibody response after an additional dose of an mRNA COVID-19 vaccine in some immunocompromised people. This action is about ensuring our most vulnerable, who may need an additional dose to enhance their biological responses to the vaccines, are better protected against COVID-19. The science and resulting data in this pandemic are moving extremely rapidly. The US government, in turn, is moving swiftly to analyze the science and make the recommendations most appropriate to protect Americans. We know our vaccines are safe and effective, and if you have not gotten a vaccine yet, please do so today. Thank you. I'll turn things over to Dr. Fauci.
Thank you very much, Dr. Walensky. So it's becoming very clear now, if you go to the first slide, that we are dealing with a global outbreak of the Delta variant. I keep updating this slide. It now shows that at least 117 countries now have the Delta variant since it was first detected in June of 2020. So let's just review some of the aspects of Delta to help put it into the context of what we're talking about. We know the transmissibility that's greater than Alpha variant, at least 2 times as great. This makes a major difference in transmissibility. The viral load is up to 1,000 times greater in the nasopharynx of people with Delta than Alpha, which is a mechanistic reason why you have such a tremendous increase in transmissibility. Next slide. In previous reviews before this group, I have shown this slide and checking the boxes as to the proof of protection against SARS-CoV-2 Delta variant. There was one glaring missing check in previous iterations of this, and that was in the J&J clinical effectiveness. Next slide. I had showed you before this slide looking at data of immune responses in vitro. And this was the J&J vaccine study, which showed that it elicited durable antibody and cellular responses against Delta with minimal decreases for at least 8 months after immunization. Next slide. We now have a slide that recently, a study that recently came out from South Africa and other Southern African countries. It's called the Sasanki study, involving about 478,000 healthcare workers. And this is real-world effectiveness against Delta, with a 91 to 96% protection against Delta, and then 71% protection against hospitalization. And remember, I showed you before that the durability of the immune response is out to 8 months. And this is the first real world data to show the effectiveness of J&J from this challenging epidemiological setting of Delta, particularly in the context of people who might have HIV. Next slide. Finally, if you look at breakthrough infections, which are inevitable with any vaccine because no vaccine is 100% effective. As you can see, as we've seen in other studies, the breakthrough infections, namely infections that occur in the setting of full vaccination, were mild in 96%, moderate in 3%, severe in less than 0.05%, with death in less than 0.05%. So I'll stop there and hand it over to Marcella Nunez-Smith.
Thank you so much, Dr. Fauci, and good afternoon to everyone. Today, I'll just take a couple moments. I want to update you on vaccination equity, as well as on the importance of COVID-19 therapies. So first, when it comes to vaccinations and equity, important to note that the majority of people who are getting vaccinated through the direct federal programs are self-identifying as people of color. So that's through community health centers, through dialysis centers, and at our federal retail pharmacy partners. Since President Biden made all adults in the US eligible for vaccine on April 19th, the majority of individuals receiving vaccines have identified as people of color. So that is notable progress, but it does not change the fact, as we've been discussing, that there is, of course, still more work to do. And the work in this phase of the vaccination campaign remains hyperlocal. And that's why the Biden-Harris administration will continue to work just hand in hand with states and territories, tribes, cities, always centering our partnerships with faith-based and community-based organizations, supporting that trusted outreach work that needs to be done. I just want to provide a couple examples of the administration's resource commitment to engage partnership. In June and July, the federal administration awarded over $240 million to support community-based workers, community-based efforts, really expanding local tailored opportunity to build both vaccine confidence and vaccine access. This past week, the CDC officially launched the Partnering for Vaccine Equity program. That's an investment of $120 million in grants that have been awarded. And later this week, $20 million will be distributed specifically to Native Hawaiian communities. In meeting people where they are, partnership is so powerful. And many of the incredible partners doing this work are health centers. This is National Health Center Week. And on behalf of the administration, I want to say thank you to health centers across the country. Your commitment, your dedication, reaching underserved groups, health centers on that front line in vaccine administration, in testing, and in the administration of safe, effective therapies. As Jeff mentioned earlier, these therapies do include monoclonal antibodies, and I want to talk a minute about those, but to people across the country, let me just reiterate, the best strategy to remain protected from the worst of COVID-19 is to get fully vaccinated. But if you get COVID-19 and you're at high risk, I want to assure you about these therapies. Monoclonal antibodies work. They are safe, they're free, they keep people out of the hospital and help keep them alive. And our surge teams have been working closely with states, increasing access, provider uptake, and patient confidence. We've conducted virtual trainings for physicians and health system officials. And this has been, in Arizona, Nevada, Utah, Wyoming, with more to come in Alabama and elsewhere. And in fact, in Arizona, we have a federal clinical team on the ground now helping to set up and run 2 sites to provide these treatments. And those efforts are paying off. Now, of the COVID positive patients the Arizona team has treated so far, not one has required hospitalization after that treatment. And we can also report that we've surged shipments to the states with the highest rates of community transmission. For example, Florida's shipments increased over 8-fold over the past month. And in July, more than 108,000 treatments were shipped all over the country by the federal government. And as Jeff mentioned, this represents more than a 5-fold increase nationally from June. Over the course of the entire pandemic, more than 600,000 patients across the country have received monoclonal antibody treatments. That's hospitalizations averted and lives saved. So the Biden-Harris administration continues to stand ready to assist states and territories and jurisdictions across the country to get more people connected to testing, to treatment, and absolutely to vaccination. So thank you so much. And with that, I'll turn it back over to you, Jeff.
Okay, well, thank you, doctors. Let's open it up for questions. First question.
This guy's a disgrace to all Jeffs.
At the Wall Street Journal.
Yes, hi. Thank you so much, as always, for doing the briefing. We're seeing a rising number of children being infected with COVID-19. So I have a twofold question. Is there data to suggest that the Delta variant is more virulent in children? And given that increase, are you still confident that schools can fully reopen for in-person instruction, or are you considering further changes to the guidelines?
Let's start with Dr. Fauci on the first part of the question, and then Dr. Walensky on the school openings. Dr. Fauci.
Thank you, Jeff. Well, in answer to the first part of your question, there's no doubt that there are more children getting infected. As I mentioned in one of my slides, the Delta variant is much more highly transmissible than was Alpha. So given that, you'll see more children likely get infected. And since you have a certain percentage of children, even though the percentage is small, certain percentage of children will require hospitalization. So quantitatively, you will see more children in the hospital. Regarding the severity of illness, there was a couple of studies, mostly international, which suggested that Delta was more severe in adults, namely causing more relative percentage of hospitalization and more severe disease. With regard to children, this could possibly be the case, but we are not seeing this in a definitive way. The only thing we know for sure is that more infections mean more children will be in the hospital. With regard to the school part about that, I think we'll go back to Dr. Walensky.
Thank you, Dr. Fauci. Thank you, Sabrina, for that question. What we know is that where we have higher rates of infection among children is where we have lower rates of vaccination in general, higher rates of community transmission. We do know how to keep our children safe. We know how to do so in schools, and we know that most of the infections that is coming into schools is coming from high rates of disease in the community. So best way to keep our schools safe, and we know how to do it, is to vaccinate everyone who can be vaccinated, vaccinate family members if children cannot yet be vaccinated, and then to follow the mitigation strategies in our school guidance, including masking in schools.
One thing I'd add there is, due to the passage of the American Rescue Plan several months ago, all schools have the resources to implement those mitigation strategies. Next question.
Josh Wingrove at Bloomberg.
Hi, thank you. Can you give us an update on the plan to start shipping those 500 million Pfizer doses that was meant to commence this month? Has that started, and what kind of pace will we see in the coming weeks? Thank you.
Thanks, Josh. The 500 million Pfizer doses that were announced in June to be donated to the world, those shipments do begin this month, and we will ship a total of 200 million by the end of this year, this calendar year, with the remaining 300 million shipped no later than the first half of 2022. So everything is on schedule there, Josh, and shipments are beginning in the next several days. Next question.
Next question, let's go to Ouija at CBS.
How do you sleep at night?
Thanks for taking my question. A quick follow-up on Sabrina's. What is the latest data about children and long-haul symptoms after they recover even from mild cases? And then, Jeff, for you, now that more entities are requiring vaccines, is the administration reconsidering something like a QR code or a passport to help verify people's vaccination status? And if not, what are you doing to stop the proliferation of fake vaccine cards? Thank you.
Okay, Dr. Walensky on the children long COVID question.
Right, thank you for that question. We are examining long COVID in children, and we are seeing long COVID symptoms, mostly fatigue and headache. They appear to be happening at rates that are lower than they are in adults, in the 2 to 3%. But of course, data with Delta and long COVID will need to be followed differently and longitudinally as we have been with Alpha. So more data to follow on that.
You know, onto vaccination verification, there are a number of ways people can demonstrate their vaccination status. Companies and organizations and the federal government are taking different approaches, and we applaud this innovation. There will be no federal vaccination database. As with all other vaccines, the information gets held at the state and local level, but any system that is developed in the private sector or elsewhere must meet key standards, including affordability, being available both digitally and on paper, and importantly, protecting people's privacy and security. The second part of your question, we are aware of some cases of fraud or counterfeit COVID-19 cards being advertised on social media sites and e-commerce platforms. While the practice is not widespread, I will remind everyone that it's a crime, and the Office of the Inspector General, the Department of Health and Human Services, is investigating these schemes. Next question.
Cheyenne Haslett at ABC News.
Hi, thanks for taking my question. I want to follow up on a question from last week about the hospitalization rates for unvaccinated versus vaccinated people. CDC has been saying it's 97% of people winding up in the hospital who are unvaccinated. Has that number changed with Delta, and do you have better numbers on the efficacy yet, Dr. Walensky?
Thank you. That 97% was data from January through June. And of course, with more and more people being vaccinated and with the Delta variant, those numbers are fluid, and we're continuing to evaluate those.
Next question.
Let's go to Kelly Leonhardt at Inside Health Policy.
Hi, thanks for taking my question. There have been reports from CDC that over 1 million people have already gotten unauthorized third doses of mRNA vaccines. Do you know if private insurances and Medicare are still covering the administration fee for these shots, even though they're not recommended currently?
Dr. Walensky.
Yeah, we are doing an evaluation of that just to make sure and understand, and we have the capacity to track this and to understand the practice. Many of these are occurring in the context of people who may believe they merit another shot, may be severely immunocompromised, and are doing so in advance of our recommendations. The one thing I want to highlight in the context of this is that it does undermine our ability to monitor safety in these contexts. So we are asking people to follow our guidance, to follow what ACIP will say and the FDA will say in the coming several days, and to follow recommendations so we can follow safety signals here as well.
Next question.
Last question. Let's go to Michael Ehrman at Reuters.
Hi, Dr. Fauci said this morning on an interview that he believes boosters in general are an inevitability. I'm just wondering how soon you expect that you might make a decision on that, and what sort of data are you looking for to make that decision?
Well, when I made that statement, it's a true statement that we believe sooner or later you will need a booster for durability of protection. Right now, as we mentioned, we are evaluating this on a day-by-day, week-by-week, month-by-month basis, looking at any of a number of studies, both international and domestic studies. And as we've stated many times, right at this moment, apart from the immunocompromised, which was just discussed, we do not believe that others, elderly or non-elderly, who are not immunocompromised need a vaccine right at this moment. But this is a dynamic process, and the data will be evaluated. The one thing we are doing is we are preparing for the eventuality of doing that. So if the data shows us that, in fact, we do need to do that, we'll be very ready to do it and do it expeditiously.
Yeah, I'll just emphasize what Dr. Fauci ended with, which is if and when there's a decision, we are prepared, we have the supply, and people will be able to get a booster in a fast and efficient way. if and when the science dictates. Thank you, and look forward to seeing everybody at the next briefing.
Good Lord. Waited over an hour just to hear that nonsense. Just a moment. Do as you're told or else you're the problem. I'm tired of them saying that. A bunch of idiots. Got some shout outs coming. Thank you so much, Alexis, Leonardo, Paul, and Richard. Thank you guys so much for your donations and your support. I really appreciate it. These people are crazy. These people are out of their mind. I can't even say anything about it because of the stupid community guidelines on the live streaming on YouTube. I'm not even going to put that on the other platforms. It's not the other platforms. It's just YouTube won't let me say nothing about it. We'll be lucky if I don't get a strike just for what they said. So stupid. I was just saying it's only a matter of time before it's mandated, before they force us to do it. I see Candace Owens on Twitter as well as other platforms constantly telling people, pull your kids out of school. Just pull your kids out of school. That's how they're going to get to all of us. They've already tried to push it on us. People have already made their minds up. Now they're going to push it on the kids. And what's unfortunate is in that message of pull your kids out of school, everybody is like resistant. Everybody's like, oh, well, I got to go to work, or I don't have childcare, or whatever. And that's totally understandable. I mean, that is completely understandable. But is it worth resisting? That's the problem. That's the problem. Is that it's supposed to be difficult. That's why they do it the way they do it, is because most people will be resistant. Most people will be like, well, maybe it'll be okay. And inch by inch, look at how far they've come. Because they're twisting that screwdriver right in your kidney the right way. And most people will just let it slide. They just let it slide. It is it's messed up. Sagittarius, everyone keeps telling me to remove my videos from YouTube. Outside of the donations, YouTube's monetization is the only thing keeping this going. I don't talk about, donation. I'm not like, oh yeah, if you would like to donate, do this, that, and the other. I don't like people telling me I'm begging and stuff. But honestly, if it wasn't for the monetization from YouTube, I wouldn't be able to afford to do this. I wouldn't be able to afford to go live. Like, I wouldn't be able to. I would not be financially able to do this. I can't afford to delete my videos after they're posted. Those views, the ads you got to sit through and stuff, a lot of that is supporting this. And I'm not saying anything bad about people who are donating. I appreciate it way more than you know. Way more than I can put it into words. I wish that I could afford to just get off of YouTube. But for financial reasons, I can't. And that's why we're trying to grow on other platforms. We're trying to make it so it's not so reliant on YouTube. It sucks. I could sit here and go on for an hour and a half about how much it sucks. Everyone who's close to me in real life, they know how much it bothers me that I am tethered to YouTube and their nonsense for financial reasons. It sucks. So it really bothers me when people are like, oh, Salty Cracker deletes his videos off YouTube, he doesn't get strikes. Well, that's great. I'm not in a position to do that. I can't do that. I'm not able to at this time. I can't wait till I can. And I'm proud of Salty Cracker for doing what he's doing and getting the truth out there and being able to run a demonetized channel and be able to afford to move forward and keep putting the truth out there. He's doing an awesome job, and I plan on doing the same thing. I'm just not that far in it yet. I'm just starting my second year. He's on like year 5 or 6 or something. Doing the best I can. I'm doing the best I can. These people are crazy. that we're watching on here. It's only going to get worse until people stand up. And thankfully, people are standing up. There's people like Mike Lindell and plenty of others that are now starting to stand up. There's people protesting, and I don't want to say fighting back. I don't want to encourage violence or anything illegal. But there's people standing against this finally. I think it's a little late, but better late than never, right? They're going to keep pushing this until there's resistance. As long as people are letting it happen, they're letting it slide, they will keep pushing it. It's only going to get worse. Look up those green zones that I was talking about earlier. They have big plans for all of us, vaccinated or unvaccinated. They have big plans for all of us. Look up the green zones. It's on the CDC website. I'm not making it up. I never am trying to give you guys any kind of false information or anything. I'm never trying to tell you guys what to do, think, or feel. But if you're really interested in the topic and how far they are willing to push this, it is right there on the CDC website. Look up the green zones. They have big plans for us. It is bad. It is really bad. Hopefully, enough people will see this and stand up and let their voices be heard, because that's what needs to happen. Can't wait for someone to save us. No one is coming to save us. I know everybody's like, oh, Trump's going to show up in the military and there's going to be eagles and fireworks and jets. And I wish. I mean, he's doing a great job, but everyone does. Mike Lindell is pushing that big right now. He's like, I'm giving everything I got to providing this information. You guys need to take the information and put it out there. Now, what he's talking about is very specific in the subject that I can't say while streaming on YouTube, but the same is true for everything that we're having a problem with right now. All of us being here together, all of us being together on the Discord, we're all in connection to all the information, all the truth. It's putting it out there. This seems to be an issue, and it's because we're being silenced on all these platforms. But that's why I'm saying, like I mentioned earlier, I think I'm going to create a tab where all these videos that I download will be on this tab, and you'll be able to download them to your phone and share it out. That is way better than sharing links. Your links can be tracked and stuff. They track it through your IP address. When you land on a link, you land on a website, you go to a platform, your IP address is being tracked. They can shut that video down based off the traffic and attention it's getting. If you have the video on your phone, you can send it through text message, you can send it through Messenger, you can post it to your Instagram, you can share it through Twitter. It may get your accounts banned, but you could send it through private messaging. There's a lot more you can do with it being tracked less than posting a link. Another thing is, like, how many times has someone sent you a link and you're like, oh, I'll check it out, and then you don't watch it? But if they send you a video and all you have to do is click play, once you start the video, you're just so tempted to watch it all the way through. So having a video and sending a video is way more effective than sending a link. That's just my perspective. That's my opinion. I think I am going to put that together. I have so much videos. I have so many videos, so much information, and so many videos. My Clapper is full of it. I don't know if you know what Clapper is. Clapper is the more toxic version of TikTok. It wasn't. It is now. But they don't ban you. And so all of my videos on Clapper are videos that I plan on posting in the Discord. And I mean, I got videos right now being sent to me. People send me clips and links and this, that, and the other, and I save them. I have them on my phone and I post them wherever I can. But I think it's important to share it with others so they can post it, because this link stuff is not working. It's not working. A lot of people are like, well, how do I get through to family members and friends? How do I get people to open their eyes? Because I try to talk to them and they don't listen to me. Send them a video. It's human nature to just follow it through. They're going to see this video with no context, no titles, no description. They're going to click play, and they might be all cringed up. They might feel some kind of way, but they're probably going to watch the whole thing. You do that to them enough, they'll have to either believe you or block you. And that's all there is to it. The more people who become aware to what's going on and air their voices and show that they're not going to just bend over and take it, the better it's going to be for all of us. That's just my opinion. I'm not trying to tell you what to do, say, or feel. I'm not trying to tell you what to think. These are just my opinions and my thoughts, and I just thought I would tell all of you. Thank you guys so much for being here and sitting with me for this 2 hours or hour or whatever we've been sitting here waiting on these people at the White House just for them to tell us that they don't care about us and they want us to do what we're told or else. Appreciate all of you. You guys are awesome. Big shout out to everyone that made donations, join the membership program, or purchase any merch. I really appreciate all of you. Please subscribe or follow on whatever platform you're watching me on right now. We go live pretty much every single day. We cover everything. Thank you guys so much. I appreciate all of you. Definitely join the Discord. That way you receive notifications every single time we go live and where we go live. Plus, there's great conversation going on 24 hours a day. Lots of information, links, and videos being shared all the time. Definitely consider joining the Discord. Thank you guys for being here. I will see you on the next live. We will go live again today. I promise. No matter what. If nothing happens today, we will at least go live and watch Mike Lindell. Thank you guys for being here. And until the next live, stand tall, shine bright, and that's a wrap.